What does hair analysis test for? That is a great question. If you've been looking for ways to evaluate the level of your health from the comfort of your own home, then you've probably run across hair analysis and may have even been wondering exactly what does a hair analysis test tell you. If that sounds familiar, then you are in the right place because I'm here to answer that question in today's video. Let's get started. Hi, I'm Dr. Kelly Shockley, Doctor of Cause, Chiropractic, board certified in sports medicine, and specialized in clinical nutrition. In this video, we're going to be going over exactly what a hair analysis test is and what it is used for. Now, the type of hair analysis test that evaluates your health is more than one strand of hair. So what are we talking about? Then we'll cover the number one reason why you should have your hair analyzed. There is so much more to understanding your health than what blood work alone can show you. And finally, I will be sharing with you the behind closed doors way to put it all together. There is more to what needs to be done than just taking some nutrition. Let's get started. What exactly is a hair analysis and how is it performed? Let's get into those details. Now, I personally run hair analysis tests on all of my patients and have been for over a handful of years. The information I get back from it is critical for me really understanding what is going on with our health. Now, there are different types of hair tests that are out there. The type of hair testing that I am talking about is one that actually looks for heavy metals, so toxins, and also tells us information about all of your essential elements. Now, in order for this test to happen, we need more than one strand of your hair, unfortunately. The way that the lab actually evaluates for that information is they burn your hair that you give them, and then they test the ash that remains for everything that we've just talked about. So you have to give them enough hair in order for there to be ash after the fact. And the interesting thing about hair is it is one of the excretory products of the body, meaning it is one of the highway systems that the body can use for transporting junk, like toxins, back out of your body. So in order to get the most accurate, the most recent information of maybe what your body is expelling, we have to see what's actually closest to your skull. So normally with the type of testing that I have my patients do when it comes to the hair analysis is they have to give me about an ounce of their hair. Preferably it's taken from the crown of your hair and then, or crown of your head. And then we send that information to the lab. They do all of their magic behind the scenes, and then I get all the results back. And from there, I can help determine what's actually going on and what do we need to do moving forward to reverse it all. Did you have any idea that there was that type of hair analysis test out there and that was involved? Just let me know down in the comments below. And if you have questions about it, feel free to drop those there as well. I respond to every single comment that I get. I enjoy reading them, so please let me know what you're thinking down below. Awesome. What is the little known reason as to why you should have your hair analyzed? Well, I semi alluded to it, but I really didn't get into it in that last topic. The main reason is it gives us so much more information or different information than what we can get from blood work alone. Now, when I started doing comprehensive labs on my patients years ago, I used to not have people do a hair analysis right away if they didn't want to. And I understand, especially for my females, like having to cut your hair off at its root and an ounce of it is not exactly something that is, really inviting for us to do because it takes a while to grow your hair. So I used to be like, that's okay. Let's just get the blood work back first, see what comes back. If I have suspicion that there might be a different type of issue that's evaluated through hair analysis, then we'll add it in at that point in time. So what happened was there were patients get their results back in. I create a plan specifically for them that involved different lifestyle changes, dietary changes, sometimes nutrition that their body needed that they just weren't going to get enough of certain nutrients, even if they could eat perfectly, which nobody does. And then we'd reevaluate them in a few months. And what I realized really quickly as I was going through this process, this beginning phase of adding comprehensive labs into my clinic, is I realized like, hey, they're not getting the results that I know they should. There's something still going on here. So let's add in the hair analysis now. And when I get the results back, lo and behold, there was a wealth of information that created so much clarity around why things were showing up in their blood work the way that they were. We change up, the plan at that point in time to incorporate addressing what we now knew was going on as a result of hair analysis. And lo and behold, the next time we reevaluated and checked our work, we would see dramatic improvements. So part of this is because it's just giving us that much more information about your health and to give us more the understanding of potentially the why behind, say, something like high cholesterol, because that's not necessarily just genetic. It's not necessarily just dietary. In fact, oftentimes it's not either of those predominantly. Your body could have high cholesterol because of a protective mechanism. Well, if we can't see what's going on in the blood work as to why might the body be protecting itself, we're missing a big piece as to what needs to happen in order to move you forward. And hair analysis shows us toxins, as I was mentioning. It also shows us essential elements, which if you're really depleted in them, which by the way, majority of all my patients are, thanks to the world we live in now, our soils are depleted, so our food supplies don't have near the nutrient density that they used to. So majority of my patients are depleted in their essential elements. Well, if you don't have enough of those, then there's not any other function in the body that's going to work properly because they all are dependent on those elements being at their adequate levels. So ultimately, the reason why it's really important to have this type of testing done is it provides more clarity on other information of things that are happening in today's world to give you that much more insight on what you need to be able to do in order to take back control of your health. Now, before I get into the behind doors method for putting all of it together, I just want to remind you to click the subscribe button down below, turn those notifications on. If you're enjoying the video, go ahead and give me a big thumbs up. Greatly appreciate that. I am producing content regularly about testing and brain health, gut health, autoimmune stuff, you name it, anything to help you be able to take back control of your health so you can live the highest quality of life while you're here. So remember, just click that subscribe button, turn the notifications on, and give me a big thumbs up. Awesome. So what is this behind closed doors method for putting it all together? Well, one of the things that I love to say with my patients is, if you're not testing, you're guessing. But it's not just about testing, because you could do any kind of testing from home. And is that enough information? And also, beside that, do you really understand the information that you're getting back from these tests? So here's the thing. As I was mentioning, it wasn't enough for me to just do blood work alone on my patients. It wasn't enough of the detail, what was lurking beneath the surface. So comprehensive testing is what allows us to really have true appreciation of your health. And the reason why this is behind closed doors is because, unfortunately, the way that the standard care works here in America, medical doctors are not allowed to do the same type of testing I am. And it's because of how they've set up our healthcare system. Medical doctors have to be able to justify why they're ordering the tests that they are. And I get that. I mean, insurance is going to pay for it. They need to know why. Well, oftentimes the reason the why is there is because this person is already having symptoms. Now, here's a little bit different thought process maybe for you. Symptoms are your body's warning signals that something is not right. And based off of what I've learned and lived since I was in high school, where my eyes were completely awakened to this other side of medicine, is that oftentimes they don't show up as soon as something goes wrong. I mean, think about it. Like, when you come in contact with somebody who is sick, you don't have immediate symptoms that you now actually have the sickness too, right? There's this incubation phase that has to happen where your body is trying to ward off this infection before symptoms actually show up. And then the other thing about that is, as soon as you start a treatment, like if you have a bacterial infection and the doctor puts you on an antibiotic, something they learned right away is that they had to start telling people, you have to take your whole antibiotic. You're gonna feel better within the first couple of days, but you're not out of the clear yet. You've just taken enough stress off the system, you've helped the immune system enough that the body doesn't have to keep sending out this signal of problem, of alert, like, hey, do something about this, because now you're winning the battle. So symptoms are the last thing to come on when there's been a problem, and oftentimes the problem's been there for a long period of time. And then as you start to resolve it, they're the first thing to go away, even though the underlying cause of whatever it was you were dealing with hasn't necessarily been treated. Okay. So I also understand the earlier you detect a problem, the easier it is to fix it. Well, if thanks to our standard of care, the way that healthcare works in America right now, if doctors are not allowed to order certain tests to evaluate their patient's health unless they have symptoms that they can now turn around and justify to insurance that, hey, here's why I'm doing this, this is how my patient's presenting, then ultimately that means that problem's already been there a longer period of time, and it's going to be more difficult for them to be able to get a grip of because they've had to wait longer. So the type of testing that I do, it's considered more investigational, which is exactly what preventative medicine looks like. We're investigating your health. How you feel is not the best indicator of how healthy you are because of what I just said. Your body has an amazing ability to adapt and to compensate. And as long as you still have reserves in your reserve tank, it can keep doing that. And it keeps doing things in a haphazard fashion until finally at some point it starts giving you some sort of signal that, hey, we're not working the way we were meant to. So now I'm going to give you this thing, this symptom, whatever it is, so you can address it. Just doing things to cover up symptoms, which is how all of our prescription medications work, they're symptom managers, they don't fix the cause, is like putting a Band-Aid on a wound, right? Or painting over a stain in the ceiling versus peeling back the layers of the ceiling, finding the leak, and taking care of that. So, if we have to wait in order for symptoms to show up, we've already waited sometimes too long. And the other aspect of how healthcare is working here is that doctors are only allowed to order the tests that pertain to that symptom. Well, guess what? Your body robs Peter to pay Paul. So your body is going to have a multitude of different potential underlying issues that are not related to the symptom that you're experiencing. Meaning, you could all of a sudden have your hair falling out. Everybody associates that with thyroid, but there's a multitude of different reasons why your hair could be falling out. All we know is that, hey, your body's saying something's wrong. We need to figure that out. Well, when you go to your medical doctor, they're going to look at your thyroid first because it's the most common reason, right? They're not allowed to do a full body analysis to truly figure out what's happening. Your body robs Peter to pay Paul. So if your body has to pick, like if your body's nutrient needs and demands are not being satisfied by what you're eating and how you're living, then there are tissues in your body that your body will self-sacrifice and break them down and take the nutrients from those tissues to give to other tissues that are more important for you to live. Crazy, right? But that's how the body works. That's why we're able to continue compensating and not knowing that things are going wrong until something, much further down the road occurs. So, for example, what do you think is more important? Your hair, skin, and nails, or your liver? If your body had to choose between your hair, skin, and nails or your liver in order to survive, which would your body choose? Your liver, right? Now, it's nice to have your hair and your skin and your nails all in good working order, but you can live, because you probably already are, with hair that's falling out or your skin's flawed a bit or your nails are brittle, dry, cracking, you're not able to grow them. I mean, people can still live. But the liver has 500 different jobs that it does 24/7. So really important. What's more important? Your muscles, your bone, your cartilage, your connective tissue, or let's say the liver? Which one would your body pick if it had to pick one to continue living with? Right, your body would pick your liver. Now, that is not really awesome, but how many of us are walking around with aches and pains, or cartilage that's wearing away? We're now knee replacement, hip replacement candidates. A lot of people. No, it's not comfortable. No, it's not ideal, but we can still walk around that way and still relatively function. But again, liver has 500 different jobs that happen 24/7. The body's not going to choose to sacrifice your liver. This is the one that always trumps people. If your body had to pick between hormones and liver, which would your body keep? Or which would your body want to have in better working order? Hormones or your liver? Now, if you said hormones, you're right with everybody else. Everybody chooses hormones because we hear about hormones all the time. But guess what? Your body will break down your hormones in order to take and put nutrients elsewhere, like the liver. Now, I wasn't being completely fair. I didn't give you the whole entirety of the story. It's not just about your liver, it's about your organ systems. Okay? Your organs are more important than those other tissues based off of survival. So if there is an issue in the nutrient demands of your body are not being satisfied, your body will break down your hair, skin, and nails, your muscles, your bones, your cartilage, your connective tissue, and your hormones to take nutrients and give them to the organ systems to try to make sure you're still going to be able to live. Kind of crazy, right? So if you really want to have full appreciation of what is the current level of your health, or if there is an issue that's happening, what is the underlying cause, you have to be able to evaluate you as a whole. And unfortunately, there's nowhere in our medicine that is doing that, nowhere in the medical system that's doing that because of how it's set up. I don't believe that's the doctor's fault. I believe it's the system that they're stuck in, okay? So if you want to take, like, hair analysis, you can do from home, easy. And there are places you can buy hair analysis kits that are very similar to ones that I use with my patients without actually having a doctor be able to do that for you. The question is, what do you do with the information you get back? How do you interpret that? What is it like? How do you make sense of it? How do you understand what else that means is going on in the body? You have to be able to look at all of it together. And as I said, the hair analysis gave me information that the blood wasn't showing me. But just as importantly, the blood is going to give me different information than what the hair is giving me. And then I also look at urine as well to really kind of paint a complete health picture of what the current level of health is for my patient at the time. Now, if you're sitting there wondering, how in the world do I do all of this for myself at home? Like, how do I find somebody who does this? Or I want to do a hair analysis. What does that look like? Don't worry, I've got you, and I can generally help you from anywhere that you're at. What I'd like for you to do is go to the description that's right below this video. Click on it so it expands. Look for the 5-day health challenge. Now, it's not really a complete challenge, and it won't take you 5 full-blown days. But what it does is it further explains this whole framework that I use with my patients and have used with my patients who come here locally in Colorado to my patients that are across the United States. It shows you the exact way to get comprehensive testing and then how to actually understand what that testing means. And based off of that information, how to create a plan that's specific to you to know what you need to do lifestyle-wise, diet-wise. Do you need supplements, and which are they if you actually need them? And for how long do you need to be on them? Because you shouldn't have to take a bazillion supplements for the rest of your life either, right? And if you're not going to do the other part of it, like, you can't out-supplement a bad lifestyle. So how do you create that custom plan for you? And then ultimately, how do you optimize it? How do you know when you're done or how things have improved? How do you know what needs to continue to be addressed or addressed differently? My whole entire framework is in there for you. And then I explain to you how to have this done right from the comfort of your own home from wherever you're at. So make sure you go down in the description and look for that 5-day health challenge. If you've got questions, drop comments underneath this video. As I said, I read all of them. I reply to all of them. I'm here to help you be the healthiest version of yourself, be able to take back control of your health. That way you can have quality of life and accomplish what it is you're here set to do without having issues. So I appreciate you. Can't wait to see you in the challenge and on a future episode. God bless.